I'd like to welcome Dr. Michelle Acorn to our discussion today. And I've asked her to talk to us about her experience in policy. So welcome, Dr. Acorn, Michelle. And I guess we'll start by asking you just a little bit more about your background and maybe what interested you in policy to begin with.
Well, thank you so much.
Oh, of course.
It's so nice to see nurse leaders initiating the policy chat. I would first like to comment on something. I feel like I'm an imposter to policy. And why I say that is also I felt like I was an imposter as a leader. And what led me to policy, I will take you on that path. May I give you a couple of examples?
Please. Yeah, no, that's wonderful.
So nurses do policy, are engaged in policy, or initiate or implement policy all the time. They just don't realize it. They're not conscious of it because they see themselves as clinicians or educators. But when you're actually sharing your expertise, you can share that you're in policy. A good example would be policy that I initiated when I was a nurse practitioner. I worked in the hospital field for 30 years, initiated policies such as medical directives to advance the scope of practice, access, for example, for nurses, for registered nurses, to ensure that patients were getting the best possible care in a timely way. That is what policy is moving forward actions for a deliberate purpose. Another good example would be policy implementation on an organizational level or a government level. For example, implementing nurse practitioners as most responsible provider is policy in action. What you need to do is change regulation or legislation, such as the Public Hospital Act, I should say, or Bill 179 to advance full scope of practice and contributions by nurses. That is policy in action. You can due diligence with policy, make sure that you're giving the best informed advice, embedding evidence into policy. You can implement policy. And then more importantly, you need to monitor the impact of policy for sustainability and ensure that it's fit for purpose, especially in modernization times such as COVID. You know, COVID has amplified the opportunity of policy to meet the needs of our population health. But again, such as, you know, across the sectors would be good examples right now. So that's why I got involved in policy. So as a clinician, you can do policy. And I would say then I changed roles to influence policy more. And I'll stop talking about that because you may want to go into the weeds more or go in a different direction, Roberta.
I am interested. Was there a point while you were a clinician and obviously creating and implementing policy at that level, was there a point that you started to realize that you could be involved in policy at a broader level or a broader perspective?
Most definitely. First, I joke, I identify as a clinician still. I still practice as a clinician, by the way, which I think is important because if you're going to advise on policy about clinician issues, frontline direct care, you need to make sure that it's relevant and you're staying up to date and you have increased credibility and legitimacy as well as you advance policy. When I thought that aha moment to your question of I can navigate locally, organizationally, I can navigate provincially, being involved in nursing associations, for example, board work, governance work with, for example, the Registered Nurses Association, the Nurse Practitioners Association. But when my peers actually recommended to me, Michelle, you should become the Provincial Chief Nursing Officer. And it was an aha moment. I never thought about that, but then I thought, you know what, I can advance policy. I can provide that strategic, clinical, technical expertise, intentional and unintentional consequences of advancing policy, and to align with the government mandates. Policy is very different if you have a lens of what it's like to be a bureaucrat and what it's like to be a politician. And you need to know your audience. And that's why I took the role. I wanted to know how to navigate the government, to navigate policy, to know how to intersect, partner with associations, with regulators, with educators, what different ministries do, and how to advance policy, and what the timing is in the cycles for policy opportunities, frankly. So that's why I did that. I never envisioned I would be the provincial chief nursing officer for 3 years. And then I realized, local to global, we need to really think about policy. It's a big world, but we have a lot of commonalities, and we do tend to think a little bit more narrow-minded when we think about our own communities, which are essentially paramount for population health. But when you see what the bigger global pictures are for policy, Roberta, such as vaccination access for health workers across the globe, and you know, we're in the queue to get our booster shots, haven't even had access to vaccination. That's policy. That's global policy. And I realized I need to be more global, because when I think about policy impact, we need to think about others around the world, not just ourselves.
You know, it's what I find interesting is that it's been quite a journey for you, that you didn't start thinking, oh, I'm going to be part of the International Council of Nurses. That you started as a clinician and over time developed skills in a variety of ways. And I know you, so it was both locally, provincially. You were the president of the Nurse Practitioner Association of Ontario. And you worked in other capacities to build skills that led you to this role that you have now. And I'm wondering if there's any part of that journey that you can name that was most beneficial or most challenging, perhaps, for you?
Sentinel moments. Pioneering the first nurse practitioner-led hospital in Canada, in Ontario, the world. Being an early adopter, and realizing, catapulting organizational support, provincial support, but being the first to journey it well to ensure you're delivering quality, safe care, professionalism, was Sentinel, and its legacy work. I'm still very, very proud of that as well, because we do know what nurses and nurse-led models of care can advance, and I really do believe that that is policy. And more importantly, we still need to address some of the policy gaps of what the enablers are to reduce any red tape, as well as the socioeconomic considerations like dedicated funding for sustainability. So that would definitely be one. Being the president of the Nurse Practitioner Association was definitely a moment to realize, if you do not have board experience, that is, you need to get board experience and governance experience to understand policy responsibilities, advocacy. What the journey taught me is you can be an advocate in associations. In government, you are not an advocate. You are there for policy, analysis, advice, implementation. So board governance is very, very important, and advocacy as well, skills. And your political acumen, you need to understand and appreciate who the audience is you're speaking to, and have an elevator speech and a latte chat. Don't go in with a little long list of 10 things. So today, Roberta, if our talk is on policy, I would say, I would get to know you and say, okay, Dr. Roberta Heel, I know you're a doctoral prepared nursing professor, a strong clinician in the past, very well rooted in addressing rural issues. What is your top policy challenge that you would like me to help you with? Because then it's fit for purpose and you can actually then leverage what you need. Those were sent moments
to really, as you say, work through the weeds. So move things away from the frustrations and the need to discuss all the problems to say, what can we actually deal with, and let's hone in. And that sounds like a skill that has to be developed quite acutely over time.
Mm-hmm. As Jerry Maguire says, help me help you. It truly is. It truly is that, actually. Help me help you, because we go in with so many wish lists and really define and narrow in what is the policy we want to address, or the change we want to address, and more importantly, what is your solution proposed?
No kidding.
Because if we're experts in the area, and perhaps we're talking about sustained funding, for example, for nursing roles, investment in nursing roles, and we go in with a bunch of things, perhaps just the opening partnership to develop a good, we talk about therapeutic relationships before we go into the big ask, and that's part of policy navigation, because it's people.
I'm just listening to you, and I think that some of the characteristics that you probably wouldn't identify in yourself, but I think are important for somebody to do the work that you're doing, is courage, a sense of, or a willingness to jump in to things, even though there may be some risk involved, and a real desire to want to learn and grow and make a difference in your profession. So I know that you probably wouldn't say that about yourself, but I see those characteristics in you. So I'm really thrilled that you're here to talk to us today about this. I'm interested in your perspective about nursing at that level in policy. And my perspective, and I may be incorrect, is that the nursing voice is sometimes drowned out by other stakeholders, other stronger or more obvious stakeholders, perhaps. And I wonder if you can give some insight into that.
My goodness, a big question and insight, obviously. I think this is gender equity. I'm going to be succinct. This is gender equity. And we feel that we don't have the power, but perhaps the true courageous conversations is when emotions are high, but stakes are higher. Nurses are 70% of the global health workforce. We have a critical mass. We journey with people throughout their health promotion to end of life. We're across every sector, and every sector includes academia, by the way. We have 28 million nurses in the world. Could you imagine that catapulting the power of everybody having consistent messaging and at least agreeing on the core fundamental principles, instead of asking to be included at the decision-making tables? Be at the decision-making tables. Make it the imperative that nurses are part of the decision-making tables. And whatever barriers to practice or barriers to participation, I would say, and not just passive participation, but active participation, we take back. The voice of nursing can be more visible and vocal and articulate and professional. We don't catapult our opportunities for social media. I think it's a very different being an employee and organizational changes, as well as maybe getting a list of experts or people that will get proper media training to speak out and work with whether it is employers or with associations to ensure that they're maintaining a professional code of conduct, that they're maintaining the code of ethics. They're doing it in a professional way that it enables the best evidence-informed capturing of information, but be at the table or be the dinner. And I truly do believe that if we traditionally continue on in typical historical patterns where other professions speak for us, how do we expect that to change? We always, if you think about even Ontario, the world, you have the same people always talking. And if we want to invest in our generations of nurses from early career nurses to mature career nurses, as we match our competence and confidence as clinicians, as leaders, as policy influencers, as thought leaders, we need to these crucial conversations, have the courage and start doing it, or amplifying it together, or mentoring on how you do it as well. And a good example is why I am here right now, Roberta. I went back to school. As you know, I am the poster nurse of continuing professional development, diploma to postdoctorate. And I had an opportunity to do a system chief nurse executive course at Case Western. And part of it, when I realized that, I just thought, I want to make sure I have the competence to be an executive practice, address everything. And I realized then I had that aha moment. I was not as global as I could be. So I went on a global mission to understand truly what is primary care? What are the sustainable development goals? How does the World Health Organization advance things? What is the difference between, government, non-government organizations and mandates? And more importantly, how do I increase the visibility, the voice, and true global impact and empowerment on the world stage as a chief nurse to show we are nurse leaders and ensure that my colleagues are represented across all countries, low, middle, high income, and all sectors. That's my goal before I retire. And I'm journeying into it 1 year, and that is policy.
It's amazing because I have known you through or quite a bit of this journey that you've had. And you're just an amazing role model for all of us. So thank you so, so much. I will leave it at this because I think you've certainly given us the flavor of the very important things that we should know about nursing and policy, and that we can all be policy movers, creators, implementers, and that there are some skills that we should seek to get as we move forward in that. So thank you very much for your work. And it's been great talking to you.
Thanks so much, Roberta. Can I leave a challenge for everybody before we finish?
Absolutely. Yeah, please do.
Go outside your comfort zone. Actually join a committee, get on a board, really become active participants in your association. Check your emotional, professional, and social IQ, and go outside of the nursing bubble as well. And more importantly, thank you, because as we talk about holistic care for the world, our patients, our populations, holistic care for nurses are critical. And sometimes perhaps thinking about this might ignite and continue your passion or expand your opportunities to get precepted or mentored as we carry on. We need strong nurses, strong leaders as well, and you are one of them. So thank you so much, Roberta, for invitation.
Wonderful.